Welcome to Oceanside Chat, Light Beyond Generations. This podcast was created to inspire, motivate, and provide insight through industry professionals sharing personal stories, career aspirations, and practical advice. Our guest is John Polowczyk, Managing Director at Ernst Young, who recently served as the White House supply chain lead on the coronavirus task force to ensure healthcare workers get what they need when they need it. Time to get your feet wet in the business world and join us down by the water as we have an Oceanside Chat. Season 2, Episode 8, Supply Chain Resilience Beyond COVID-19. Welcome to Oceanside Chat. I'm Helen Wang, the host and editor of the program. As an industry professional, I have experienced several supply chain disruptions caused by catastrophic events, including the series of natural disasters in 2011. At 2:46 p.m. Japan Standard Time on March 11, a magnitude 9.0 undersea megathreat earthquake triggered a tsunami, which caused the nuclear accidents in Fukushima, located on the Pacific coast of Tohoku in Japan. As the most powerful earthquake in Japan, Tohoku earthquake and a tsunami caused almost 16,000 deaths and 300,000 people relocated. Supply chain companies within the region were severely destroyed and impacted. Unfortunately, just a few months later, from July to October of the same year, there was the worst flooding in terms of water and people affected in Thailand, further triggering landfall. As a result, multiple tiers of suppliers were affected by both disasters. We applied critical learnings from the Japan earthquake to the Thailand flood. For example, we learned to prioritize humanity, safety, and relationships in crisis management. We learned to improve transparency to assess the true impact from multiple layers of supply chain. We also learned to diversify sources and locations to mitigate similar supply risks. These are great examples of building resilience in supply chain. We cannot predict or stop natural disasters, but our ability to manage disruptions has improved. Now, fast forward to recent years. 2021 was record-breaking for supply chain disruptions. Just to name a few, winter storm slammed Texas food supply chain, Suez Canal blockage of more than 350 ships, then a cyber attack on the Colonial Pipeline. Besides extreme weather and cyber crime, there has been an ongoing China-US trade war since 2018. And the Russian-Ukraine war started last month. Last but not least, pandemic outbreaks and lockdowns around the globe since 2020. As industry professionals, we are familiar with a common clause in supply chain contract called force majeure, which essentially frees both parties from liability and obligation when an extraordinary event or circumstance beyond the reasonable control of the parties, including but not limited to acts of God, earthquakes, hurricanes, flood, war. Previously, the negotiations were hypothetically scenario planning, but now the changing environment and unprecedented disruptions have become a reality and the new norm. For this episode, I'm honored to invite an exceptional guest, one of our board members from the Institute for Supply Chain Excellence and Innovation at UC San Diego, to discuss the hot topic of supply chain resilience beyond COVID-19. Please join me in welcoming John Polowczyk, the Managing Director at Ernst Young and the retired U.S. Navy Rear Admiral. John, thanks for your service and welcome to the Oceanside Chat.
Thanks, Helen. I appreciate you asking me to partake in the podcast and webinar.
I wanted to ask you a few questions to begin with. Whose life seems most fulfilling to you, and what does their life look like?
I've got a couple of folks that have always been mentors to me. I gravitate to somebody that I met at a very young age after graduating high school, going to the Naval Academy Prep School. I met Captain Dick Stratton, who was a Vietnam War POW for almost 7 years. He was a naval aviator, and he was my first commanding officer. You thought you had a bad day growing up. You want to talk about 7 years of bad days. So he had a way of putting things in perspective. And I think when I think about the answer to that question, somebody who has served and done so with a very light heart and have been fulfilled by a lifelong of service, endured so others cannot endure or should not endure. I think those are the people that I admire most.
Wow, thanks for sharing. This is a great way to begin today's conversation, John. What is one thing that people would never guess about you?
Let's see. People can talk about they're a dog lover, they're a cat lover, but my wife and I support an animal rescue, a miniature schnauzer rescue. And I have probably in the last 4 or so years have helped rescue and foster somewhere around 28 miniature schnauzers. I think there's been one giant schnauzer in there. The process of a foster is somebody that can take a dog in for a short period of time. Sometimes that's months, sometimes that's weeks, sometimes it's days. Get them evaluated, medically checked, and understand their fitness, so to speak, for a family environment that may or may not include children, old person, how much exercise, right? People wouldn't believe that I've been told to not come home from travel, stop here, pick up a dog, bring it there, and then you can come home. So, yeah, even as a flag officer, we all have a boss.
Yeah, we see the priority. Have you ever told someone Santa is not real?
Have I ever told someone Santa is not real?
Mm-hmm.
Having 3 kids, at some point they figure it out. And no, I never had to tell anybody Santa's not real. And I'm not quite sure I would tell anybody that Santa's not real.
So, John, all of us tell stories about ourselves, and a story defines us. What story have you written so far?
I think if I was to write a story about myself, it would probably have a title around the accidental admiral. I went to the Naval Academy in the early 80s to really do nothing more than play Division I lacrosse. And if I put myself back in walking the halls of my high school, doing all the things needed to apply to the Naval Academy, and then having to go to the Naval Academy Prep School, I could not even imagine my career. And I can tell you, my dad was a PhD chemist, academic dean at a university in New York, well-educated person. And when I told him I wanted to go to the Naval Academy, he was sitting on the sofa after dinner reading the New York Times, and an edge of the newspaper came down, and he looked at me and said, "Oh, really?" And the edge of the newspaper came back up because I was mostly interested in wrestling, football, and lacrosse than I was in academics. And I think that story would have started about then. And I don't really remember what I probably said to myself, but his lack of belief probably fueled a little bit of, I'm going to do this. And I think in that arduous journey, you always build a lot of self-confidence and figure out, well, if I survive that, I can do this. And I think that accidental admiral started with that, is that a challenge? So I start that book that way.
Great story how you started. You have 34 years of experience in supply chain and logistics strategy, technology, and finance. A very fulfilling career from Navy to the White House, then industry. So if we think of life as a book, which one is your favorite chapter?
I think the early years of developing, going through the Naval Academy, graduating and being a Navy supply chain professional, the early years were filled with lots of learning, lots of adventure. I mean, I've been to the North Pole, surfaced on with a nuclear powered submarine in the North Pole, and had to manage all of the logistics for a nuclear powered submarine and all the deployments it's made and the supply chains to support it. And like, who gets to do that as a 20-something-year-old? Right. And then being on all the platforms and supporting things, and being on a ship in the Gulf of Mexico to have Hurricane Katrina somewhat run over the top of you and manage the Navy's response to Katrina. So the early years are very exciting, informative, educating, building things. And then maybe there's that somewhat middle chapter that's the later part of my Navy career. You're senior, you have incredible responsibilities that I'm managing all of the Navy's business systems and having to really understand the technologies and develop a strategy to improve and move forward. I'm a comptroller by background, financial management. I'm an acquisition professional. I've worked on buying pieces of nuclear powered submarines, et cetera. I'm a supply chain person. I've done planning. I've written new concepts. And in that later period, I found myself on the Navy staff and then on the joint staff, where I was managing all of the joint processes for the global force, whether it be munitions, whether it be all the fuel supply chains and everything else, and doing a lot of deep logistics planning to include thinking about industrial mobilization in time of conflict with great power, near peer competitors out in the years 2030 or so, and saying to ourselves, what authorities do we need? And is the Defense Production Act the right authority? So as I end that chapter, I find myself with all of that background of deep logistics planning that both the chairman of the Joint Chiefs and the Secretary of Defense felt comfortable in sending me over to Health and Human Services to help them do some logistics planning for the pandemic, which turned into, we had nobody managing the national supply chain response. Hey, Admiral, we'd like you to go do that. And find myself talking to Vice President Pence, who said, yep, I want you on part of the task force, stand up a supply chain task force. And next thing I know, I'm in front of the nation briefing that on a Sunday afternoon.
Wow. So from March to November 2020, you were the White House supply chain lead on the coronavirus task force.
Yeah.
Could you describe your experience in 3 to 5 words?
Hectic, exhausting, intellectually stimulating, all wrapped into one. If I was just to pick one word to describe all of that, unbelievable.
I'm sure our audience wanted to know a lot more about this unbelievable experience you had. So before that, just want to set a background. Over the last 3 decades, minimum political risk encouraged management to outsource and offshore for profitabilities and shareholder returns. But now that we have a global pandemic, climate challenges, a war, and increasing geopolitical tensions, those efficient supply chains appear to be very vulnerable and fragile in the face of catastrophic disruptions. So, John, is there a quick fix to strengthen the supply chain?
So, Helen, you just articulated what I stepped into, especially in the medical industrial base. It was very linear. It was outsourced to the max. In fact, we were 85 to 90% reliant on overseas sources. Hospitals, to some degree, really relied on just-in-time delivery. I mean, you pick your major hospital network. Some of them certainly had warehousing capabilities, but many don't, and relied on daily deliveries from the medical supply chain professionals, whether it be a boxed kit of something to manage a surgery, to when it would show up on a hospital floor. This was your daily demand for those types of material. It was sized and designed for a steady state demand, and there was no thoughts of resiliency. I'm being unfair, I realize in some sense, but really, I think if you were a medical supply chain professional, you would say, yeah, it's pretty much sized for daily demand, and there wasn't a whole lot of resiliency in the system. And it was efficient and designed to have absolutely the lowest price to help hospitals maintain solvency.
So this topic of resilience, maybe we could utilize your experience leading the supply chain stabilization task force for COVID-19 as a real world example. Could you take us into the situation you faced when you arrived at the White House? What are the challenges or problems that you face, and what was your mission?
Everything I just said, right, was part of the problem. We didn't make anything, so to speak, in America. And hospitals didn't have any inventory to rely on. The medical distributors had some inventory because they were relying on overseas shipments, and there's a life cycle to sail time from Asia. But really, that system, as I said, was very linear, just in time, and didn't have echelons of supply. And really, this is apolitical and not about any administration. The national stockpile was never really designed for a 50 state, 6 territory, long-term pandemic. It had some supplies in it. But if you can remember back here to the left, 9/11, anthrax, we had all these anthrax letters and things. So it was a chem bio, like, hey, we need the ability to have something in reserve to help a selected region. So this national stockpile was never a pandemic stockpile. And that fact has never really been put out. So there was not a holistic federal government thought about how to manage a medical industrial base for a pandemic. So if you go back to the pandemic plan that previous administrations had helped write, and you read them, yeah, those plans knew you were going to need gobs of stuff, but then it didn't have the levels of details into it to then go execute, and who was going to be responsible for the gobs of stuff. And so as I walked into the stand up a task force, right, the national stockpile had been given out, like delivered pro rata share by population to 50 states and 6 territories. There were no surge contracts. So Health and Human Services or anybody had not had, think about everything. If you think back to March of 2020, what did you see on your TV? You saw CNN, MSNBC News, everybody, doctors, they didn't have N95 masks. They have severe shortage of supplies. And so there was no contracts in place to say, okay, we're going to surge that. I could not believe that we just had some boxes to stuff on the shelf and then nothing afterwards. We had no US industrial base to surge from. It wasn't like I could just go to, well, we did a little bit. We went to 3M and said, make more N95 masks. The government did not have a significant public-private partnership with industry for pandemic supplies. Health and Human Services had no expertise. They did not have people in supply chain. They did not have people in logistics. And they certainly did not have anybody like the Department of Defense had that managed a defense industrial base, because nobody cares more about nuclear aircraft carriers than the Navy does, and how the nation needs to keep technologies and manufacturers in livelihood so we can deliver those things for the nation. Health and Human Services did not have that mindset in people managing a medical industrial base. And we certainly didn't have any thoughts about strategic suppliers and people in reserve. This is why I said it's hectic, it's exhausting, it was stressful, and yet it was unbelievable because I got to lead essentially the largest industrial mobilization and uses of the Defense Production Act since probably the Korean War. So that's the problem I stepped into. Go fix it.
Yeah, it brought back those memories. All of us are watching all the news channels and trying to figure out what's going on, what supply do we have, why do we have shortages, what's the next shipment. And I still remember those daily briefing, right? Until you showed up as a supply chain expert and you're able to tell us what exactly happened, how many was on order, what's coming. So that's where the first time supply chain expert in those daily briefing at the White House, I feel like this is the Superman we need in that kind of situation. So how did you solve the problem? I mean, given all the complexity and lack of preparation that you just described, and
Yeah,
in particular, what
yeah,
process, approach, and the methodology did you use?
yeah, absolutely. It was essentially an elephant, right? How do you eat an elephant one piece at a time? But I did have a little bit of help. There was a retired Army Special Forces colonel that had some medical background that was the chief of staff at Health and Human Services. He helped very quickly orientate me. His name is Paul Mango, fabulous individual. I kind of say things like, thank God for Paul Mango. He had been doing some thinking about this, and he was kind of like, hey, John, here's the state of play of the medical industrial base and our reliance on other things. He helped me kind of get up to speed. But what I took away from our conversations about what's the problem we're trying to solve was time. That like we were not going to solve this. This was not going to be a light switch. This was going to be a rheostat. And I devised 4 lines of effort to get after the biding of time so I could get to the last line of effort. So the first line of effort was preservation. And this turned into what you hated and saw in the news. We were going to make our supplies go longer, last longer. And this ended up being reuse. This has ended up being the decontamination of N95 masks that nobody, nurses, doctors, nobody liked. We even figured out how to put 2 people on a ventilator because we thought we were going to run out of ventilators, right? So there was a preservation line of effort. And we put some money in things, technology against that. Then there was an accelerate line of effort where we attempted to work around the globe to find sources of supply, buy it with federal dollars and bring it here. I had one caveat to that though, is if it was a source of supply that was being purchased by a commercial entity to deliver to a hospital or a state to deliver to a hospital, do not compete with that. Don't buy it out from under them. Find new sources of supply that may or may not be going to US healthcare. Buy that and fly it here. That turned into Airbridge, where we did buy both federal product and we helped the commercial marketplace who had dedicated sources of supply that they used maritime mode of shipping, where it wasn't cost effective to stick a 20-cent mask on an airplane and fly it. But guess what? This was a pandemic and I needed to prime the pump. I couldn't wait for 30 days, 38, 40 days to float it across from Asia. So we put it on airplanes and flew it. That turned into Airbridge. The third line of effort was probably the thing that I'm probably most proud of, which got the least coverage, which was a data line of effort. You can't manage a supply chain unless you can see it and make sense of it. And so I fall back on my owning all the Navy business systems and knowing what ERPs can and cannot do, et cetera. We managed to use the Defense Production Act, Title VII, to allow commercial industry to give me their transactional business daily information. And we started small. The gold standard was an N95 mask. Where are all the N95 masks, right? And so we added things onto that. So if you think about the 9 or 10 large medical distributors, we hooked all of their ERP, we dumped all their ERP system into a cloud at FEMA, and then brought in a visualization tool on top of that. And by the second week of April, by probably around April 10th, we had visibility to what was in every warehouse in the commercial network, what was coming from manufacturing, their sources of supply, and what their orders were from every customer that they had. And mostly the customers I cared deeply about were hospitals and nursing homes. And so those 10 medical distributors provided product to about 95 to 98% of the hospital beds in America. So I was like, good enough for me. I don't need to know, like the next 2% was probably not worth it. And the same thing for nursing homes. They delivered to about 95% of all the beds in nursing homes in America. So by the second week of April, I had supply and essentially national demand. And then throughout the rest of the spring, we added a way for hospitals to give us visibility and nursing homes to give us visibility of their supplies on hand and be able to forecast when one hospital system may be running out of supplies. And so then we could take state, federal, commercial product and go feed the hungry, so to speak. So there was a data line there. There was a data line of effort where, unfortunately, in the beginning, I was managing scarcity. But in the end, we were making sure that everybody had the ability to get the products they needed. And that started small N95 masks. And then it ended up having essentially anything that you needed for a pandemic and all the drugs and pharmaceuticals to go with it. The final line of effort in that is this expansion line of effort where it was, how do we make these things in America? How do we, so we can have more of it and not be reliant on overseas sources, and use the Defense Production Act to expand US production, whether it be an N95 mask, whether it be needles and syringes for the vaccine, whether it be how to get everybody a test kit and a swab to test themselves, right? So there was just a massive effort to expand the US industrial base. A very long answer to how did you organize for this? We had a multi-agency task force at FEMA at first, and then over in Health and Human Services that had people from Commerce, Treasury, Office of Management and Budget, the FDA, Department of Defense, the Department of Homeland Security. I mean, you just name it. Every agency in the federal government had somebody on my task force.
Wow. If I were to thinking about the major takeaway from this 4 steps, right? You find a way to remove the constraint of time, and you expedite the speed. And then you also brought the visibility to both supply and demand, as well as production in the US. So that gave us a lot more control over the longer period of time. That's fantastic within a shorter period of time. So John, from your experience, how would you define supply chain resilience?
Yeah, so there's certainly textbook versions, right? I mean, people use words like ability to withstand shocks, those type of things. I think about it as certainly resiliency, the capability to recover quickly. And when I think about where we were on, I'll just say the 16th of March, when I showed up at Health and Human Services, we had no ability to recover, certainly not quickly. And it's got to have something in there about design not to break. I think about a very naval aspect. You're only strong as this weakest link in your chain. And we had a lot of weak links. And so I have that vision in my head about all of the different pieces that have to happen: manufacturing, distribution, transportation, right? Almost every piece of that broke.
So I thought it was interesting to share this definition from the White House fact sheet in terms of resiliency. This is what they say: the ability to recover from an unexpected shock. It requires visibility, agility, and redundancy. We have an audience ask the question, after your effort at the White House, if there's another virus and a pandemic scale occurs in the next 5 years, are we ready?
We gave Health and Human Services a vision for the National Stockpile 2.0, so to speak. And walking down the path to do that, I'm going to answer that question, but I got to go backwards to go forwards. When I had an approved retirement prior to the pandemic, I was supposed to retire from the Navy after 34, going on 35 years in June of 20. I didn't retire until December. When I left Health and Human Services and FEMA and the task force, I gave then Secretary Azar a letter about what we did to get to where we were so people wouldn't forget the movie. and what was in front of Health and Human Services. And in that letter, I described the need for Health and Human Services to have somebody that understood supply chains, understood logistics, and understood the facets needed to manage a medical industrial base. I was not asking the secretary to go to Congress and say, you need to stand up a DoD-like organization where you're managing fighter aircraft and other weapon systems, and you're managing, like, you just have these huge, massive programs. I don't know what the number is. It's not thousands. It's not 1, 10, 20, 30 government officials that are versed in supply chain and manufacturing and could manage a medical industrial base. Because SNS 2.0, National Stockpile Redefined, you need to have a basis to which to draw from. So you needed a US industrial base to do things like surge contracts. You needed a data system, the supply control tower that I built, to manage this flow. And really, that flow is a supply chain tower in the middle, understanding in a pandemic environment and a public health emergency. What are the hospitals, nursing homes, and people that are going to treat patients? Do they have the supplies or not? You had a need for states to have things, hospitals to have a little bit of a stockpile. A national stockpile is an absolute backup, and those echelons of supply should probably give you months worth of shock absorber, so you can kick in your surge contracts and the industrial base can have time to ramp, all with the data ecosystem needed to have the visibility across that. Unfortunately, we were on the road to visioning that, and I had to step away along with some other DoD members. And Health and Human Services does not really have the staff yet to go do that. And so the answer to the question is that we're better off. The national stockpile, when I showed up, had 18 million N95 masks in it that had been given out. In December of 21, when the Biden administration made the decision to issue 400 million N95 masks from the stockpile, that was half the stockpile. It had about 850 million. It's not like we're completely broken, but you were yet to be linked together in the fashion that I've described, and to be able to be reliant on surge contracts and put this ecosystem. We have the semblance of the data, but we don't have all the other pieces. This is a non-political. This is just my view of a DoD logistician who's gonna plan for the worst and have the things in place needed for a long-term fight. And I just don't see us as a nation there yet. I hope I answered the question, which was, did you fix it? Yes, but no.
Yeah, I'd like to describe the recent efforts from the government. So in February 2022, 7 cabinet agencies published reports identifying key weaknesses in some of the nation's most crucial supply chains and devising multi-year strategies to address those weaknesses. The White House also published a capstone report that provides an overview of the key actions the administration has taken over the past year to reduce the vulnerability of U.S. supply chain across a range of key sectors. For the benefits of the audience, the 7 cabinet agencies are Department of Defense, Homeland Security, Commerce, Energy, Agriculture, Transportation, and Department of Health and Human Services. So it's a quite comprehensive report and an assessment. So John, in your opinion, what are the emerging perspectives and the collective efforts from the US government about building Americans' long-term resilience across critical supply chains?
That's a really complicated question. And I know I'm not going to do it absolute justice, but there are a lot of things in motion. I can start with current administration, the Biden team is working something that I personally find like, wow, if this works, this is going to be fabulous. The project is called Flow, but Flow is really at its heart understanding freight across America and to unstick the sticky pieces of it to get supplies moving to consumers in the United States. And I've talked to various officials that are working on that task because they were very interested in the supply chain control tower that I built at Health and Human Services. I believe that was one piece of the work I think is certainly going to be enduring, because I know in the supply chain reports, Health and Human Services and the White House highlighted that as an enduring feature. And that effort flow is really about how do you ingest or how do you take in commercial information and safeguard it, aggregate it so nobody gets hurt, but then you can use it to make decisions. And you can imagine if I was Landstar trucking firm, I may or may not want to tell you how optimized my fleet is or not, right? Or if I'm Norfolk Southern, I might not want to tell you my sticking points for my railroad. The Department of Transportation does not have a freight czar. I think they're trying to create one because they have an airplane person, a road person, a maritime person, right? They're kind of like this. Who is freight across America, right? So you just think about that. And in fact, how do we optimize freight across America? I hope they can work that project and get to an outcome that they can really see where issues are, reapply resources to unstick things. That would be fabulous. If anything, that is a data effort. Congress, both House and Senate, is working on two pieces of legislation that get after a lot of things. One's called the America Competes Act. One's called the United States Innovation and Competition Act. They both focus on chips. Why don't we make chips in America, right? And they could unlock a lot of supply chain problems. But then there's a lot more in those. And there's money for resources for medical, for pilot, for about medical supplies. There's like $1 billion something for public wireless supply chains. Certainly an infrastructure problem for some of this. There's Buy American, there's robotics, advanced manufacturing, the National Science Foundation, potentially $45 billion. We'll see what Congress actually appropriates for doing activities essentially that sound like onshore and or moving facilities to places, as you alluded to in the beginning, might not have anything to do with China or Russia or other folks, right? And if I took those 7 reports, DoD, Homeland Security, et cetera, and save people from reading them, I think that there's several themes across them. They all talk about dollar investment needed. They talk about a trained workforce. I can tell you in DoD, just from my shipbuilding understandings and days, welders. We talk more about welders, right? I mean, so whatever the workforce is, trained. And I will tell you there's probably a digital training along in there as well. Investments in new technologies. One of my least favorite things we have to talk about is stockpiling. But something that we did in the task force was to try to figure out very quickly how to onshore all the pharmaceuticals that we might need for the American public. So we went and bought a whole bunch of advanced pharmaceutical ingredients and put them in a stockpile because God forbid we were shut off from those. So stockpiles have a place, but it's one dimension of resiliency. Resources, tax credits, partners and allies. But the single biggest thread across all of them is data. And so I think the federal government is thinking through that. But I go back to one of my educational experiences in my DoD days was at the Industrial College of the Armed Forces. And really that National Defense University, that college is now called the Eisenhower School, was all about maintaining the ability for the Department of Defense to mobilize the nation. And we thought about things and people wrote theses on how education fits into mobilization. Finance, what are the mechanisms that industry and government can do? Healthcare, you need a healthy workforce. You need a well-fed workforce, things that you wouldn't normally think about, all the manufacturing experience. I think we called it telecommunications back in the day, but there's a data piece. And I can go on and on about how to mobilize a nation. And I brought all of that to the supply chain task force. But I think in the end, the federal government has to take a look at that ecosystem. And we're going to have to solve the data exchange to understand it. We're going to have to have a much more agile manufacturing. And we're in the fourth industrial revolution. And I can tell you that from my task force days, it's not about bringing a machine that was being used overseas to make a mask, bring it to the United States, put US labor on it, et cetera, and have it be competitive. We're gonna have to innovate and use advanced manufacturing techniques to make it competitive. I think it's all those investments. So I see an immense amount of activity and in the right direction, but it's not a light switch. It's going to be a rheostat. And the one thing that I don't see that would make me feel a lot better is the one person being put in charge. We produced 7 different reports. Congress is undecided on, is it Department of Commerce, Department of Homeland Security? Who is responsible for the US industrial base?
Yeah, that's absolutely a critical point. I just wanted to share FLOW stands for Freight Logistic Optimization Works, right? FLOW. There are so many reports out there. I haven't read all of them, but I took away a few industries being identified critical for future supply chain from those reports. Just to name a few: semiconductor industry, battery, information and communication technologies, rare earth elements and materials, the PPE, healthcare, pharmaceutical ingredients, and vaccines. So those are the ones seems to be on top of the list from industry standpoints. John, as a tradition of our program, I hope to build an intellectual bridge between the current and future generations. Einstein said any intellectual fool can make things bigger and more complex. It takes a touch of genius and a lot of courage to move in the opposite direction. So John, would you like to paint a picture of supply chain resilience by giving a new perspective?
Sure. I'm going to keep it simple. The Marine Corps has a motto of Semper Fidelis, always ready. And occasionally people morph that to Semper Gumby, always flexible. When I think about supply chains, and I think about what I walked through in the beginning of the pandemic, it was not always faithful and it was not always flexible. It had a lot of weak links in it. We must take advantage of the fourth industrial revolution and get to Semper Gumby, having the ability to be agile and flexible to withstand any change and any shock and any dynamic and adapt and overcome. If you can think about it in that manner, I think you're very well off. And it's not a very complex thought, but that's where my brain gravitates to.
Yeah, that absolutely captured the essence of resilience. I also have an idea to exchange with you. So imagine a resilient supply chain system as an intelligent ride-sharing network. Firstly, a reliable digital platform provides real-time data exchanges between supply and demand, as well as trading conditions. Secondly, the system manages obstacles and recoveries from car accidents, traffic jams, and road blockage through optimization and adjustment in order to minimize disruptions. Lastly, the system makes predictions based on historical data and real-time visibility to look for machine learning patterns and drive continuous improvements. In other words, just like the ride-sharing system, an innovative and resilient supply chain networks is built on trust, visibility, agility, predictability, and adaptability. John, we really appreciate your leadership in building a resilient supply chain and your partnership in exploring different perspectives on this imperative topic. What is the final thoughts or one thing you'd like the audience to remember?
Well, let me pick 2 things. If you ever get a chance to step into and lead in a crisis, pick something big, bold, and go after it, right? That's one thing. On the supply chains, I really do think the end-to-end visibility and the data infrastructure across the supply chain is key to building a response as you go forward. And if I can put my EY hat on for a moment, when we help people stress test their supply chains, 5 things come out of it. And one of those is end-to-end visibility. Mm-hmm. And so I'd end with that. If they take nothing more away, that they realize that end-to-end visibility has a piece in supply chain resiliency.
Yeah, that's brilliant. Thank you. I want our audience to remember that a supply chain network, as you said, John, is as strong as the weakest link. So our job is to identify the weakness and strengthen the system. In addition to technological advancement and the supply chain strategy, the risk mitigation plan always depends on the resilience of your supply chain partners, and your relationships with them makes the difference. I like to share the poll result. So the first one is, what's the weakest link of the US supply chain system? And it's a single choice. We have majority of our audience, 55%, answered upstream, which are the raw materials, electronic components. And then interestingly, the second highest vote was logistics, either from air, ocean, or land. That was 24%. And then we have 10% on the midstream as well as the downstream. So that's the weakness. In terms of the strengths, which is a multiple choice, we have almost 60% of audience answer R&D, followed by logistics, 38%, and then production and manufacturing, 21%, and 10% for services. So John, what are you thinking about those answers from the audience?
I tend to agree that we have some degree advantage in the upstream raw materials, et cetera. We do a lot of some of that here, send it away, then it come back, right? And so there's a lot of that. I do think that we do have a lot of technology, et cetera, part of the value chain. I think the audience captured pretty eloquently the strengths and weaknesses.
Thank you, John. I hope you enjoyed our chat, and I hope our conversation leads to many more discussions about supply chain resilience in the corporate boardroom, supplier meetings, as well as at the dinner table and beyond. Thank you, everyone, for attending our live webinar and listening to our podcast. We will be back in 2 weeks.
Thanks for listening to Oceanside Chat. We hope you enjoyed this conversation. If you liked it, please share this podcast and stay tuned for our next episode. We'll see you later.